I am the patient.
I am the nurse.
I'm the RD.
I'm the speech language pathologist.
And I'm the family member with my service dog, Louie.
Mrs. Jackson? Oh, looks like she's sleeping. Hi, I'm Meredith. I'm the nurse on duty right now. Are you a family member?
Yes, I'm her daughter. My name's Allie.
Okay, wonderful to
Nice
meet you,
to meet you.
Allie. Is it all right if I give you an update about your mom's care today?
Absolutely. I have power of attorney, so I'm authorized to, handle some of her
Wonderful.
healthcare.
So this morning we turned your mom a couple of times to prevent pressure ulcers, which can sometimes develop when patients are bedridden for long periods of time. And along with that, we do frequent skin checks. But her skin looks great at this time, and we have nothing to worry about in that area. And then your mom's scheduled to have a bath later this afternoon if you're here.
Okay, that's great. I'm really glad that we don't have to worry about pressure ulcers. Those sound serious. And I'm pleased to know that she's, getting a bath. But I'm really concerned about her eating. She hasn't eaten anything since she's been in the hospital. Isn't she hungry?
We noticed that she's not eating well, like you did as well. So I did call her skilled nursing facility, Sunnybrook, this morning to learn more about her normal eating habits when she's at the facility. They also said that she hasn't been very responsive lately and not eating that much. They did say that she does need some assistance with eating, and it takes her a long time, like I'm sure you're aware of. And they also said that she's starting to have difficulty with chewing and swallowing, even with her dentures. So I'm not sure if you've started to notice that as well.
Definitely.
But to answer your question, yes, she is likely hungry, but because of her progressing dementia, she may not be able to communicate that with us.
Yeah, she has been having such a rough time lately. I noticed something on the door, something about NPO, and I think someone else mentioned it. I'm not really sure what that means.
Yeah, so NPO is just an acronym that means that your mom is not able to eat anything by mouth right now. So since she can't eat normally, we have been keeping her hydrated with IV fluids.
Okay.
And I have requested a consult with the RD and SLP.
Okay. Keeping her hydrated, I understand that's great, but when does she get to eat? And the RD, the SLP, who are these people? What is that? When are they coming soon?
Yeah, those are all great questions. So an RD is a registered dietitian, and the SLP is a speech language pathologist, and they should be here any minute now. Oh, there they are.
Hey Meredith, how are you?
Hey, I'm good.
Good. Hi.
Hi.
I'm Laura. I'm the dietitian here.
Hi.
How are you?
I'm well. I'm her daughter. My name's Allie.
Good. It's nice to meet you, Allie. I'd like to go over some nutritional aspects of your mother's care. Is that okay if I discuss that with you?
Yes, absolutely. I have power of attorney.
Okay, good. Good.
Oh, sorry. I have power of attorney, and that's actually the diet is what I'm most concerned, or the eating is what I'm most concerned about. The nurse mentioned and explained to me a little bit NPO, but I'm still a little bit unclear on that. All I know is that I'm really worried about her being hungry.
Well, NPO simply means that she's not eating anything by mouth because she's physically unable at this point. So the doctor made a decision saying that it's not safe for her to eat by mouth. And the more information we get from the speech pathologist, that might help you understand it better.
Okay, all right, that makes sense.
Um,
Yeah. I don't know, how is she going to get enough to eat?
Well, there's other ways to feed her if that's necessary, and we can get some more details from Meredith so I can give you a little bit more information, okay?
Okay.
I can understand that you're worried.
Yeah.
Meredith, how did her labs look this morning?
Yeah, so I did look at her lab results that came in. So Laura, her BUN is at 10,
Okay.
creatinine is 0.9, and her potassium is at 3.6.
Great. Allie, so it sounds like her value for her BUN is normal, her nitrogen balance is fine, and that means she's getting enough protein. And her creatinine is normal as well, and that relates to muscle loss and kidney function,
Okay.
meaning she's okay there. And her potassium is normal as well, so she's getting the appropriate fluids and electrolytes,
Okay.
which, we're hydrating her. And this means that she's in pretty good shape nutritionally. I've calculated her needs, and Vera and I are discussing what to do about her diet for implementation tomorrow, and we need to figure out the best way to where she's the most comfortable.
Okay, I'm sorry. I know I've asked so many questions. I'm just so worried.
I can understand that. Vera, tell me what you found about your swallow study.
Hi, Allie.
Hi.
My name is Vera. I'm a
Nice
speech
to-
language pathologist.
Nice
So I
to
was
meet
here
you.
yesterday evaluating the chart, and I've noticed on the chart that your mom chokes while eating, and she's also pocketing food.
Yeah.
So I performed the fibroscopic endoscopic evaluation to assess her swallowing. So at this point, it will be safe for us to change her diet order to dysphagia level 1
Okay.
and to elevate her while eating, prevent aspiration.
Okay. What does that mean exactly? The dysphagia and the aspiration. Those sound serious.
It is serious, but it's manageable. So dysphagia is a condition characterized by difficulty of swallowing
Okay.
and chewing, and sometimes it causes pain. So people with dysphagia might be unable to swallow at all, or might have some difficulty swallowing liquids,
Wow.
solids, or saliva. So if left untreated, it might get into the airways and get to the lungs, and she might develop pneumonia, which can prolong her stay at the hospital.
Yeah.
And in order to avoid that, we'll just monitor her diet and to meet her nutritional needs and just prevent aspiration.
Okay. Could she choke?
Yes, not only she could choke, but foreign objects in the lungs can cause infection.
Oh my. So that other thing, the dysphagia diet, what is that exactly?
So this diet consists of pureed, homogeneous and cohesive foods, which is a pudding-like consistency. So there's no coarse textures, raw fruits and
Okay.
vegetables, no nuts are allowed in this diet, and any food that require chewing are not allowed.
Oh wow. Okay.
So thickened liquids might be required also, but she's getting enough hydration from IV. I'll be checking her drinking abilities later. So
Okay.
for now, we also have room service here at the hospital, and somebody will be here to assist you with food orders.
Gosh, that sounds so complicated. As far as the thickening of liquids, if that becomes something that you folks think is necessary, can I just ask some more questions on that later?
Oh, sure. I can give you a few handouts on the diet and liquid modifications before your mom is discharged.
I would love that.
Yeah, but for now you don't have to worry about it because our hospital kitchen has everything necessary for this diet.
Okay.
You can also look at the menu options for your mom. So there are a separate section for the dysphagia diet where you can see what's available and what's allowed
Okay.
for this diet. And if you have any questions, just let me know. I'll be stopping by to check on your mom's progression with her diet.
Okay, that's great. Thank you so much.
So, Allie, even if we feed her a level 1 dysphagia diet, we're still going to need to assess if she's getting the calories and nutrients that she needs.
Okay.
And sometimes eating the diet alone won't be enough.
Okay.
So we may need to feed her another way to make up the difference. Do you know if she has a set of advanced directives?
Yes, she does. I actually have them right here.
Great. Does it say anything about her wishes for nutrition interventions?
Yeah, I was looking at it earlier. Yes, it says that if she can't eat orally, that she would like to be fed enterally. I don't know what that means.
Okay, well, enteral nutrition is when we use a tube and it's inserted through the nose and down through the throat into her stomach to deliver the food there, and she doesn't have to swallow on her own, which right now she's having difficulty doing.
Okay, does that hurt? Is it dangerous? Is it, any risk?
It's a very quick procedure. It's a little uncomfortable. Meredith has done a ton of them, and it's very simple. There's usually no complications, and we're going to take great care of your mom, and then she can get the food that she needs. Meredith, I'll let you schedule that tube insertion.
Yeah, and I have time this afternoon. I'll make sure that gets done today.
That's great. I'm so glad to hear that she'll be eating soon.
Us too.
Great. Allie, do you have any questions for any of us?
Not right now, but thank you so much for all that information.
You're welcome.
Would it be possible for me to get everybody's contact information or give a card? or
Absolutely,
anything?
absolutely. Here's my card with my extension on it.
Thank you so much.
And here's a handout on
Thank you so
enteral tube feeding, so you can read up
Thank
on
you.
that.
Oh, that's
Okay.
great. Thank you very much.
You're very welcome. And we'll be back to check on you later, okay?
Perfect.
All right. Nice to meet your therapy dog.
Thank you very much. He's a good boy.